Hello everyone. First of all, I would like to introduce to my group. We are group 1 and I'm Inchi Women and my team members are Oing Ung, Sean, Megan, and Elena. In today's presentation, we're going to talk about Singapore National Sport, commonly known as SNB. In today's oral presentation, we're going to deal with this topic. Firstly, let us look at what SNB is. The Singapore Nursing Board, or SNB, is the statutory authority responsible for regulating the nursing and midwifery professions in Singapore. It was established in 1975 and operates under the Ministry of Health. The main functions of SNB include registration, licensure, and regulation of nurses and midwives. Through these responsibilities, SNB ensures that healthcare professionals meet the required standards and are competent to practice safely. By setting standards and monitoring professional conduct, SNB helps maintain public confidence in their nursing. Secondly, I want to explain the concept of regulation. Regulation refers to the rules, standards, and laws that govern nursing practice to ensure patient safety and professional accountability. In healthcare, regulation is important because nurses make decisions and perform procedures that directly affect patients' health and well-being. Without proper regulation, there may be inconsistency in practice, ethical issues, and risks to patient safety. Therefore, regulation provides a framework that guides nurses in delivering safe, effective, and professional care. Now, I would like to discuss the key principles of nursing regulation. The first principle is patient safety. Patient safety is the foundation of nursing care. Nurses must always prioritize the well-being of patients and take steps to prevent harms. Regulations help ensure that healthcare practices are carried out safely and according to professional standards. The second principle is professional accountability. Nurses are responsible for their actions, decisions, and professional behaviors. They must practice within their scope or competence and accept responsibility for the care they provide. Accountability helps maintain trust between healthcare professionals and patients. The third principle is ethical practice. Nurses are expected to follow ethical values such as respect, integrity, confidentiality, and compassion. Ethical practice ensures that patients are treated with dignity and that their rights are respected throughout the care process. The final principle is competence and continuous professional development. Healthcare is constantly evolving, and nurses must continue to update their knowledge and skills. Lifelong learning enables nurses to provide evidence based care and adapt to changes in healthcare practice. SNB plays a very important role in guiding nursing practice in Singapore. So, how about currently issues and demands in Singapore? So, my friend Sean will continue the presentation. So, I would like to hand over to the next speaker.
Thank you, Key. Now I will continue by talking about the current issues and demands in healthcare. So first, healthcare systems today are facing several major challenges. One of the biggest issues is aging population. Since people live longer, there's a higher need for long-term care and management of chronic diseases like diabetes and hypertension. Another important issue is the nursing shortage. Many healthcare settings are facing a lack of qualified nurses, and this leads to heavier workloads and can also impact the quality care. Workforce burnout is also becoming a serious concern due to long working hours in stressful working environments. Many healthcare professionals experience physical and mental exhaustion. And at the same time, we also see increasing demands in healthcare. Patients today expect higher quality care and more specialized services. On top of that, healthcare workers are expected to be more competent in advanced technologies and complex clinical procedures. In addition to that, digital adoption is also very important. Technologies like telehealth, electronic medical records, and artificial intelligence are changing the way healthcare is delivered to the patients. So now, overall, system today is not only facing challenges like aging population, nursing shortage, and burnout, but also higher expectations in terms of quality, competency, and digital transformation. So now we have already looked at the current issues and demands in healthcare. Let's move on to how healthcare system is actually responding these challenges through some key trends. One of the most important key trend is digital health and artificial intelligence. And these technologies are assisting healthcare workers to improve efficiency, make better clinical decisions, and improve patient outcomes. Another important key trend is telehealth services. This allows patients to access healthcare remotely, where, which makes a healthcare system more convenient and more accessible. We also see a strong shift towards patient-centered care. This means focusing on each patient's individual needs, preferences, and values when planning their care. Evidence-based practice is also very important. Nowadays, healthcare workers or healthcare professionals are using the latest research findings to guide clinical decisions and improve patient outcomes. At the same time, professional development is becoming essential. Continuous learning helps healthcare workers stay updated with new knowledge, ideas, skills, and technologies. And finally, collaboration is a major trend. Now that the healthcare system is more team-based, where nurses, doctors, and other professionals work together to give safer and better quality care. So overall, these trends are helping the healthcare system adapt and change the way healthcare is delivered to the patients. So now that's all my part. Now I would like to hand over to the next speaker, Megan.
Thank you, Shun. So now that we understand the functions of nursing board a little bit better, let's look at the key issues that SMB aims to address. So the first issue is actually patient trust and nursing conduct. So healthcare relies heavily on trust because patients place their health and personal information in the hands of healthcare professionals. Patients need confidence that nurses are qualified, competent, ethical, and safe to practice. To maintain this trust, SMB ensures that only properly trained and registered nurses are allowed to practice. It also sets clear standards regarding professional conduct, ethical behavior, and scope of practice. SMB further supports nursing competency through continuing professional education, practicing certificate renewal, and return to nursing requirements. Together, these measures help ensure safe, professional, and consistent nursing care for patients. So for this slide over here, we'll talk a little bit more about actions taken by Singapore Nursing Board to achieve the goals that they've implemented. So to achieve these goals, the Singapore Nursing Board has actually implemented several important measures. So the first one being how SNB regulates who can practice as nurses, midwives, and advanced practice nurses in Singapore. Secondly, it issues practicing certificates and approves nursing applications to ensure only qualified individuals are allowed to provide care. So SMB also accredits nursing education programs to ensure that nurses receive proper training before entering the profession. In addition, it establishes standards of practice, scope of practice, and ethical guidelines that all nurses must follow. Finally, SMP promotes continued competency through continuing professional education, annual practicing certificate renewal, and return to nursing requirements for nurses who have been away from practice. These actions help to maintain a competent nursing workforce and ensure patient safety. So for this slide, what happens when SMB rules are not abided by? So there are actually a couple of consequences that will arise from it. The first one being a loss of patient trust. So patients depend on nurses to provide safe and professional care. So if the nurses fail to follow established standards, they may be viewed as irresponsible, unsafe, or even incompetent. This can reduce public confidence in both healthcare institutions and the nursing profession. The second consequence is unsafe or unqualified nursing practice. Without proper regulation, nurses may practice beyond their scope, work unprofessionally, or even practice without a valid practicing certificate. Such cases may lead to complaints, investigations, suspension, removal from the nursing register, or even legal consequences if the patients are harmed. So, overall, failure to comply with SME guidelines can reduce patient trust, increase unsafe practice, and negatively impact the quality and reputation of healthcare. So now I will pass the mic on to Ying-En, who will further explain the impacts of SMB and standards of practice.
Thank you, Megan. Now I will talk about the impact of SMB and standard of practice for patients, empowerment, continuity of care, and equity. Empowerment increase their independence and also build trust between healthcare providers and patients. Continuity of care ensure that medical information is clearly passed on, reduce mistakes during handovers, and increase patient trust in the healthcare system. Equity means standards ensure fairness so that all patients receive equal quality care regardless of their background. For familiars participate in shared decision making, healthy literacy, and advocacy role. Shared decision making allows them to be involved in care planning, which strengthens collaboration with healthcare providers. Health literacy improves because standards require clear communication, helping families understand medical information more easily. The advocacy roles give families the confidence to stand up for patient rights and take a stronger part in protecting care. For nurses' part, nurses provide professional identity, legal protection, innovation support. The professional identity reinforces nursing as a respected profession, establishing clear responsibility, recognition, and strong sense of accountability. Through legal protection, nurses are shielded from unnecessary blame and supported with clear legal frameworks when conflict arise. By supporting innovation, standard guidance to integrate new evidence-based methods which enhance both their professional growth and the quality of patient care. Last part is healthcare system. The impacts are cost efficiencies, global recognitions, and crisis resilience. Cost efficiency shows how standardized care reduces duplication and waste, helping the system save valuable resources. Global recognition comes from aligning with international standards, which enhance credibility and allows healthcare professionals greater mobility worldwide. Last is crisis resilience is strengthened because standards improve preparedness and response during public health emergency, making the healthcare system more capable and reliable.
Now, onto nursing's unique role. What makes a nurse so unique compared to other different healthcare professions? Firstly, is the biopsychosocial approach. What is biopsychosocial? It is basically a term used by clinicians to describe the biological, psychological, and social factors. Unlike doctors who focus primarily on treatment and diagnosis, or alike professionals who specialize in specific functions, nursing standards emphasize caring about the person whole, physically, psychologically, socially, and spiritually. By focusing on the big picture, addressing a patient's physical, emotional, and social needs rather than just treating a disease.
Secondly, a multifaceted scope of practice. Nursing integrates tasks such as administering medication, mood care with emotional support, advocacy, and intensive documentation, unlike any other healthcare professions. Lastly, nurses operate on the front lines of patient safety. They offer consistent monitoring that ensures even the slightest changes in conditions are identified. The SMB, Singapore Nursing Board, require nurses to conduct ongoing assessments to recognize deterioration and act accordingly, a responsibility that no other profession holds continuously at the bedside. Here are some examples of how nurses differ from other healthcare professions so that you are able to see the difference clearer. Nurses versus therapists. Nurses typically thrive in hospitals or acute care settings. It's a fast-paced environment where immediate needs has to be met and conditions can change in a hurry. Therapists, on the other hand, they usually operate in specialized clinics, private centers, or rehabilitation centers as well. The environment is structured around a schedule, focus sessions to help patients regain specific faculties over time. Now, nurses versus pharmacists. Pharmacists focus deeply on medication itself. Their interaction revolve primarily around drug safety, dosing interactions, and proper usage. Nurses, however, focus squarely on the patient. While they administer medication, their primary interaction is geared towards overall health management, ensuring the human being sitting in front of them is recovering comfortably and safely. Now, on to nurses versus doctors. Doctors often have brief interactions with patients. They connect during their morning rounds or specific appointments to diagnose, prescribe, and direct the overall treatment plan. Nurses, however, provide the continuous bedside presence. Because nurses offer holistic care and spend hours by the patient's side, they are often very they are often the very first ones to notice subtle change in the patient's physical or emotional state. Now let's talk about influencing patient care. Firstly, patient advocacy. Nurses speak up for patients when wishes aren't being respected and ensure that informed consent is genuinely understood. Patients, especially those who are elderly, confused, or from non-English speaking backgrounds, have a professional in their corner who is obligated to represent their interests. The SMB standards require nurses to assess patients across physical, psychological, social, and spiritual dimensions, not just their medical diagnosis. Secondly, holistic assessment. A nurse caring for a post surgical patient doesn't just monitor the wound, they also assess the pain experience, anxiety, family support, and ability to self care at home. How would this impact the patients? Well, needs that would otherwise go unnoticed, such as depression, after diagnosis, or lack of caregiver support at home, are identified and addressed. Now, I'll pass the time to Ying to talk about the influence of clinical decision making.
Thank you, Elena. Now, I will talk about the influence of clinical decision making. First is professional development. Updated competency frameworks require nurses to continue learning and undergo regular skill assessment. This keeps them up to date new technology, therapies, and ethical standards, which strengthen their clinical decision. Second is system resilience. Standards prepare nurses for public health emergencies by including crisis protocols. As a result, future clinical decision making will be faster, more coordinated, and better supported during pandemic or disaster.
Thank you, Egan. So now I'll be addressing the problem statement, which is who we think as a group protects the patient. So before we get further into that, we need to know that patients are protected through three main areas: regulation, accountability, and nursing judgment. So firstly, I'll be talking about regulation. So as Key has mentioned in the previous slide, regulation refers to the rules, standards, and laws that guide nursing practice and ensure patient safety. So for example, nurses must be properly registered before they can practice, and they must have valid practicing certificate. This helps prevent unqualified people from giving nursing care. Regulation also includes following the SMB standards, code of ethics, and scope of practice. This means nurses should only perform tasks they are trained and competent to do, such as giving medication safely, documenting care properly, and knowing when to escalate concerns to doctors or senior nurses. So next, I'll be talking about accountability, which means nurses are responsible for their own actions and decisions. They must provide safe patient care, follow SMB standards and ethics, and make responsible clinical decisions. Nurses also need to maintain accurate documentation because proper records help to ensure continuity of care and protect patient safety. Being accountable means that nurses cannot simply blame others if something goes wrong. They must practice carefully and professionally. Last but not least, nursing judgment is important because nurses are closest to patients and often notice concerns first. So they advocate for patients' needs, rights, safeties, and preferences. They also prevent errors by carefully checking medication and care. If a patient's condition changes, nurses must escalate the concern to doctors immediately. Overall, nurses protect patients physically, emotionally, and ethically through their roles as caregivers, observers, communicators, safety checkers, and their advocates. So, after comparing regulation, accountability, and nursing judgment, our group finally believes that nursing judgment plays the most crucial role in protecting patients. So, while regulation provides the rules and accountability ensures nurses take responsibility for their actions, nursing judgment is what directly influences nursing care at the bedside. Nurses spend the most time with patients and are often the first to notice changes in the patient's condition. They use their clinical judgment to assess situations, identify risks, prevent errors, advocate for patients, and escalate concerns when necessary. For example, if regulations and standards are in place, a patient's safety may be compromised if a nurse fails to recognize a deteriorating condition or make an appropriate clinical decision. Therefore, regulation and accountability provide the foundation for safe nursing practice, but nursing judgment is the key factor that transforms these standards into actions that protect the patients every day.